Well, hello, everybody. It's been a while since we have done an After the Secretariat Call podcast. And we started that because if you ever watch The Bachelor or The Bachelorette, after the final rose. So we're after the rose gift of the LCME Secretariat Call. Are we not, Colleen?
Yeah, it's a gift of some sorts.
It's a
Yes.
gift of many sorts. Yes, indeed. So, all right. So we are going to debrief the call that just happened last Thursday. We are, in case you're watching this at some other time in the future, or the past. I don't know. That could be someday that could happen. Yeah. They could time travel back in the past and watch us. Like, I don't know. So, but we are going to be talking about the call that occurred June 2025. That Secretariat call is the one we're going to talk about. And they
Mm,
focus on three elements, and we are going to pick two of them to kind of chat a little bit about. So the one I love to talk about is PBL. So 6.3, because it is still, I'm going to be honest with you, Colleen, it's still a little shocking to me that people don't quite understand this one.
completely agree. Yeah.
Right? So I'm gonna break down like my two big points on that. So one is work with schools all the time that say, well, we've got PBL in the clinicals, right? On pediatrics, on internal medicine, like they don't want PBL. I mean, you can do PBL in the clinical clerkships if you want to. That is not what they are looking for.
No,
They
it
want
doesn't count.
does
Doesn't
not
really count.
count. Does not count. It's got to be in your preclinical curriculum, specifically in the preclinical curriculum. The other thing, and they said this again, it's the famous, so how much should we have? And we heard the famous, like, we don't prescribe that, right? It's up to you. It's up to you and your curriculum committee to decide how many.
Mm,
And Colleen, Colleen, I want to hear what you say. In our experience, one, not enough, but you also don't need 10, right? So like just figure out kind of what makes sense for your curriculum about how many.
that's right. And another piece is that time to complete all four pieces
Yeah.
of it. So remember, you need all four components of self-directed learning, and they need to be within however they phrase it, reasonable amount of time to complete it. So you can't open a case, have students write learning objectives, and then go back to the case in 4 months. So that's not going to count either for self-directed learning.
Right.
The other thing, I'm at a school that does significant PBL. We have tons of PBL in our first 2 years of the curriculum. And, we're also in a place where we're wondering, is that too much? It has wonderful utility and it helps students build skills that we can't do in other learning modalities. But trying to find just kind of the right amount for your school is really where it's at. Where's your sweet spot?
Yeah, absolutely. And I want to emphasize again, then we'll go on to the next one about it doesn't all have to happen in one session, but yeah, it has to happen like probably the longest I would say is over the course of maybe 4 weeks. And if it's in subsequent sessions, like you're doing a case and then I'd say that's probably the end of my comfort zone is around 4 weeks to get it done in. So and I think the other thing is again, we've worked with schools who um the schools give like a list of objectives or something like that. Again, no, the student has to come up with their own questions. So, okay, we probably
To
beat.
give them to them at the end of the case. So some
Right.
schools will do that. It's
Great
totally
idea.
fine, but you have to have the students going through the process
Yeah.
that is really outlined. And Jenny, I'm going to say it here because it's for another call in the future, but I am very curious what PBL is going to look like in the future of self-directed learning with AI.
I love it.
So put a pin in it. That's
Yep.
not something the LCME is going to address, but that is something that we as schools need to be thinking about,
Yes.
is kind of self-directed learning in the age of AI.
I love it. I love that. All right. The next thing I think I'm going to tell people to put a pin in is for 5.5. So
Oh my.
right? They talked about resources for clinical instruction. Here's where I think the pin needs to go. So everybody brings up, and it was brought up on the call. Well, what if we are sharing clinical sites, clinical space for required clerkships with the DO school? And
Mhm.
again, on the white paper, it says MD school. Here's what I'm going to tell you. Okay. And she kind of said it, but in the usual LCME way, kind of not, but kind of did, but kind of not. So you're left to guess, as we always are, which is one of the reasons why we do this podcast and help other schools with our consulting. So here's the deal. There is a table. I'm forgetting what number the table is. I forget which one it is, but there's a table where you have to list like each of your hospitals and your clerkships, and then you have to list how many students from your school are there and how
Yep.
many outside learners are there. And so what has been said is that I think it's a good idea to have affiliation agreements if you're with DO school. I'm going to tell you right now, not only is it a good idea, you just damn well better do it.
Yep.
Okay?
Just do it. Do
Just
it.
do it, right? Like
Just do it.
Nike, just
Yeah.
do it. Now,
Absolutely.
one thing we're not saying just do it on for this, but I'm telling you could be coming. Put a pin in it. health profession students. So
That's
on
right.
another Secretariat call, this was actually brought up that it is something that LCME has discussed, and it may come in the future, that if you are sharing a course, and we're not talking electives, we're not talking sub-Is right now, we are talking about your core clinical clerkships. If you are sharing a required clinical clerkship with a DO school, you better get the paperwork. And if you're sharing it with like a health professions school, so you have PA students around, that's wonderful learning. But again, how many are there enough patients for your medical students? I
That's
will,
right.
my bottom dollar that affiliation agreements for that are going to be coming. Not yet, but I think soon.
And even if you're a school who's never seen a citation on the patient census, the ratios are looked at. I've been at a school that was cited on this and they absolutely do the math. So do be
Yeah.
very cognizant of that and do put, as Jenny already said, all of them kind of into one bucket. It's essentially them compared to your number of students
Yeah.
at your MD school and then the patient census.
Yeah. I know we were with one school where I think the patient census on neurology was something like 3 to 4 patients, and there was like 7 learners between them and another school. It's like that's not math does not compute, right?
That's right. And
Yeah.
5.5 in that regard, I mean, how does that relate to your required clinical experiences? So really, how do you ensure that everybody meets their patient log requirements, for example?
Yeah, 100%. All right, the very last thing, because we try and keep these short to keep your attention span, but the last thing they talked about was one of my favorites, fairness of grades.
Oh, yes.
That is, I think, everybody's favorite right now. I don't have a lot to say on that one, except, I think one thing that they did say was about they're not looking for students to that you can never which is, like to be perfectly happy with everything, right? They're at least acknowledging that. Now, if that makes a difference, citations we'll have to see, but it's just that the process has to be clear and very concise. That the students know exactly how their grades being calculated.
That's right.
Um,
And you need to be able to showcase how you're checking that. Even if you say, well, everybody goes to the same places at some point in time, you still need to look at comparability. However, you can swing it, figure it out, talk with your colleagues at other schools, talk with us, and think of a way in which you can truly look at it because you have to be able to say across the board at all these sites, across these preceptors, there was comparability.
yeah, 100%. Yep. I think any final words for this after the final secretariat call?
No, it's always there'll be more to come.
Oh yeah, for sure. Next week I think is about curriculum, so we'll be back with that one next time. And that's all we got for this time. Oh, sign up for our newsletter. You can go to my website and sign up for our monthly newsletter where we highlight a certain element every single month. And we'll talk to you next time.
All right, bye everyone.